Welcome to Weight Loss and Wellness for Real, a podcast where people like you get the practical solutions and support you need to permanently lose the physical and mental weight so you can feel better and live the life you really want to live in the body and mind you really want to be living in. If you're looking to overcome your stress eating, overeating, binging behaviors, and move to a place of food and body freedom, as well as find more meaning and more moments of joy in life, you are in the right place. Hey everyone, thanks so much for being here and listening. Today I have with me a very special guest. His name is Dr. Jeffrey Gross. He graduated from the University of California, Berkeley with a degree in biochemistry and molecular cell biology. He earned his Doctor of Medicine in 1992 from the George Washington University School of Medicine. After graduating, he undertook a residency in neurological surgery at the University of California, Irving Medical School until 1997. He then pursued a fellowship and chief residency in spinal biomechanics at the University of New Mexico until 1999. He is licensed in the state of California and Nevada. He's a trained neurological surgeon. He specializes in athletic injuries and spine procedures and offers longevity and biohacking consultations. He achieved board certification by the American Board of Neurological Surgery and is a member of several very prestigious medical societies. He has written textbooks and articles in his area of expertise and is a peer reviewer for the state of California and a scientific journal. Since 2020, Top Doctor recognized Dr. Gross as a leading neurological surgeon. He also received Health Tap's 2022 Doctor Award as a top neurological surgeon in the U.S. Dr. Gross founded Recelebrate, focusing on anti-aging and regenerative medicine. The mission for Recelebrate emphasizes offering modern biochemical treatments and considering surgery as your last resort. I'm super excited to talk to him. We are going to get all into this world of stem cells and exosomes and longevity medicine. I think you're going to learn a lot. Thank you, Dr. Jeff, for being here. The audience heard a little bit about you, but could you maybe just talk about how your journey into maybe, I guess I'm going to call it the longevity space, the regenerative space, kind of happened from, because you were really more classical medicine for a while, right?
Yeah, and it sounds like classical music. I was reading piano, sheet music and all that. But right. And I'll explain that, and I'm sure a lot of people understand. And thank you for having me. I should have started.
Yeah, thanks for being here.
It's great to meet you. But I was practicing traditional medicine. I was trained traditionally. I am a neurosurgeon by trade. I have a fellowship in spine. I was doing a lot of neck and back care, disc problems, pinch nerves, other things, injuries, that kind of thing, and neurological issues pertaining to the spine. And what I had learned to do came from wonderful professors who had learned it 20 or 30 years earlier than they trained me 20 or 30 years ago. So really, when you look back at the history of things, I was doing things that was essentially the same as what they were doing 40 to 60 years ago. So, there are some advancements. There's a little new widget or smaller incision or, all this. But what we really do, either making more room in the spine or fusing the spine, which is still somewhat significant.
For sure.
Was what hasn't changed. So patients actually stimulated me. They came and said, hey, doc, the physical therapy didn't work. The chiropractic didn't work. The acupuncture didn't work. I used some anti-inflammatories. They didn't work, and I don't want to take a bunch of pills. And we tried some injections in my spine. Yeah, they worked for a minute, but they didn't last. Right. And they turned to me and I said, well, let me get out the menu. And the menu says, looks like surgery is the only thing left. And they were smart. They'd say, well, I'm not sure I'm ready for that. I'm not that bad, even though it does bother me every day. And I say, you're kind of right. I don't want to offer you surgery until you're that bad. So, And they would say, what about stem cells? And I would say, I don't know. Didn't really study it much since college when I looked into, I was a molecular biology, biochemistry student. But I then whisked off to med school and residency, and I love that stuff. I can nerd out on it, but I forgot about it. So I finally, kind of like a rubber mallet hitting you in the head, I said, instead of going to these spine surgery meetings every year to hear the same old Kool-Aid drinking stuff, I went to some stem cell meetings about 7, 8 years ago, and I started retraining and re-educating in order to offer it to my spine patients. And it has blossomed into so much more than I ever expected. And that's where I am now. Sorry for the long-winded explanation.
No, I love it. Yeah, no, it's great to get that background and just kind of how you moved from that landscape into this. Well, I would say new, but it's not that new.
It's not.
Yeah, I know. I actually, and this was part of my selfish reason for wanting you on, but I actually did have a stem cell treatment about 12 years ago. And where I had it done, I think I was the second patient. I'm in South Dakota, so things are a little bit slower moving in South Dakota. So I was the second patient in this place in South Dakota.
Right.
And that was on my knee. And so I was fascinated at the time with all of that. So it has been around for a fair amount. And I'm assuming a lot of changes since then, because I would love you to maybe talk a little bit just about, and for maybe people who don't, everybody's probably heard a stem cell, but like maybe people who don't really understand exactly what it is. And then also the exosome stuff that is going on.
Yeah, great. So you basically just opened up like 60 minutes of me just talking. So
Great.
I'll try to chunk that out here. But
I guess just talk. Yes, that's great.
sorry, I don't want to do your job. I couldn't do it as well as you.
No,
but.
it's good.
So, stem cell medicine is coming along. It's rapidly developing. The U.S. is slow to get it. 15 years ago, you were blazing a trail with someone, and professional athletes have left this country historically for 20 years or more, and still do. Just recently, there's a certain NFL player leaving the country. I won't name him just out of respect, but
Sure.
You can get that here in the U.S. You don't have to leave the country anymore. There are some, things you have to be cautious. We're not allowed to make any claims because the FDA has not yet approved for marketing claims. Regenerative medicine in general. But what is regenerative medicine? Stem cell medicine is really tapping back into some knowledge that we've gained about how a certain population of cells that created us when we were an embryo and a fetus, that then helped us grow and develop when we were children, and then when fully grown, are used to help regenerate, heal, repair, and maintain us until they sort of lose their steam, like most of our cells can if you don't maintain them through a long list of genetic, things and proper supplementation, proper diet, proper sleep. We could go on and on, right? You've many podcasts on these topics. So so they become less functional. And then one of the models of aging is that your stem cell population just can't help maintain a more youthful cell activity.
Right.
So anyway, we're tapping back into that knowledge by using that strategically to help us repair better, function better, heal something, whatever the case may be. So these can be used for, like, the low-hanging fruit is joint and spine, reduction in inflammation, which is seen in osteoarthritis, improvement in joint function, cartilage production, cartilage maintenance, things like that. So that's the low-hanging fruit. And then it can be used for IV and things like that. Now, I said that generically. Those are stem cells, but there are really three main flavors of regenerative medicine. The lowest flavor is called PRP, or platelet-rich plasma, which comes from your own blood, and they spin it down and take the growth factors out and can reapply it somewhere. And that could be in a tennis elbow, or you can have a cosmetic procedure. You can have a vampire facial or hair.
I've heard of those, yes.
Hair growth, yes.
Right.
And Halloween's coming up, so there are plenty of vampires. And then maybe that's why vampires live so long. They access this young blood,
Right. Yeah.
And I don't want to go into other, nefarious Hollywood types what they're doing.
Sure.
But it probably is tapping into this youthful regenerative source. And then the second layer would be stem cells themselves. But it turns out if I deliver stem cells, Heather, into your vein, intravenous, 10 to 14 days from now, they'd be gone. But the benefits last longer. And why is that? If they're gone, what's happening? Well, those stem cells have delivered cell messaging, smaller bodies to your cells. Your cells then do the real work.
Okay.
They're reawakened. Their inflammation activities are reversed into an anti-inflammatory mode, and when you're in an anti-inflammatory mode, you can function more optimally and go back to what you're supposed to be doing: healing, repairing, regenerating. So you're either aging and degenerating, or you're the opposite, you're regenerating. So we're trying to push it into the regeneration side. Anyway, those small stem cell derived communication bodies, those cell-to-cell signaling bodies, are called extracellular vesicles. And to the audience at home, there'll be a quiz later. I hope you're taking notes for these important biochemical terms. But those, for fun, are called exosomes. So when we speak to exosomes, we're speaking to how stem cells work. We're speaking to the business end, where stem cells are really the delivery vehicle mostly, and these are nicer, I think, because they travel better in the body. They pass through the blood-brain barrier if you need them in your brain. They are more concentrated and abundant, and they're less than half the cost of good old-fashioned stem cells. Yeah.
Oh, fascinating.
Yeah.
So you offer that, and we'll talk a little bit about your company and that sort of thing too. I know you offer that. Is it are there many people like you in the US who are doing that?
Yeah.
Okay.
I think we're all a little different, but yeah, we're around, or, and most major metropolitan areas have someone like me, and even in other areas, like you said, you found someone 15 years ago. So we're out there.
Well, true. Yeah.
You don't hear as much about us because we are not allowed to advertise certain things.
I know about that.
So what you see, if you search stem cells, you're going to find all the Central American, Mexico, Panama, those pop up because they can advertise. We are in violation of certain statutes currently, unless we're in the state of Utah. The state of Utah on May 1st brought in a certain. They passed a law earlier, and it came effect May 1st, where with certain disclosures, they can actually make claims about regenerative medicine.
That's fascinating. I didn't know about that. Yeah. Okay. So things are changing a little bit.
Yeah.
Slowly but surely.
Yeah.
Do you can you speak to what you think 5 to 10 years where we might be with some of this? I mean, I think a lot of us think about things, regenerative medicine, like growing new limbs or new organs or, things like that. Is that something that you see coming along, or new joints even? I'm thinking 3D printing, things like that.
Yeah, I mean, that's coming, and in Europe and in China, they're already, blazing that trail. They're way ahead of us. So we learn a lot from good science done in those places. So I think we're going to be slowed here. And I'm going to put on my tinfoil hat just for a minute. And
go ahead.
And big pharma is starting to get their fingers in this and dabbling in it, because as long as they can monetize it, it will happen. So that's
right.
The political and economic forces that slow it down are self-evident.
Yeah, absolutely. Where with some of this, I mean, I'm assuming insurance does not. Well, does some insurance cover PRP now, or?
Oh, yeah, that's a great comment. So none of regenerative medicine is approved for marketing claims by the FDA, and they throw around the word approved, but that doesn't mean you can't do it. It means it's not approved for marketing claims. What claims?
Got it.
So we are very clear not to make any claims. I can tell you stories and anecdotes and show you pictures, but I cannot make any claims. But as a surgeon, I've never guaranteed anything, right?
Sure, of course, yeah.
So I'm used to not making claims. That's easy. But PRP, the insurance company, these people who make lots of money off taking your premiums in, figured out it's cheaper to pay for a few PRP injections than it is to pay for a surgery, and it was working.
There you go.
So they actually are starting to, many of them are paying for PRP. So the combination of that move and the combination, the profit side of health insurance, and the combination of big pharma getting involved in this, and companies that make, knee replacement devices and stuff, they're going to have to get their fingers in it. Otherwise they're going to die. So it's coming. It's probably not as fast as we want here, but
sure. But
you know,
it will happen.
seek it, and you shall find.
Yeah. Okay. What would be, maybe someone who would be best candidate for, something like this, stem cell injection? And can I just, maybe this is a really dumb question, but is a stem cell injection different than an exosome treatment?
Only by what's being delivered. We really can do
Okay,
the
so it is
same type of
different then.
things. Yeah, it's
Okay.
well,
Yeah.
okay, well that's there's overlap, right? Because stem cells
Okay.
make exosomes. So
Right.
you're really getting stem cells and exosomes when you get stem cells, whereas exosomes are just pure exosomes.
Got it. Okay. So who, again, sorry, back to the original question, who would be, a really good candidate for something like this? Because I'm thinking about even my stepdad right now, he's getting ready for 2 knee replacements and that sort of
Oh,
thing.
no. No. I need to talk to your dad first. Here's the thing. There's always going to be a role for knee replacement, but
Sure.
there are a ton of those being done, and only because many doctors aren't aware of the options to delay and prevent that.
Good point.
And so I would love to see people who are bone on bone, loss of cartilage, knee arthritis. I'm doing finger quotes for those of you who don't have the video of this podcast. Um, and that loss of cartilage is also metabolic, right? If you're not healthy and you're inflamed, your joints will feel it.
Right.
So we help those people, tune up their life and their health. And then there is an approach to help that knee improve through stem cells, exosomes, whatever we recommend, whatever your regenerative doctor recommends, to help people delay and or avoid knee replacement. So that's the low-hanging fruit, the simple fruit. We get pretty good results across the board. That's not a claim. It's just an observation. And if we can keep people away from that surgery and make them functional, and they can stay younger and healthier, they can keep moving.
Yeah, that's wonderful. What about, I'm kind of, my focus with this podcast, I do a lot of, I'm a mental health therapist, so I'm in the emotional world, the mental world. Do you happen, and this may just be a quick no, but do you notice anything in regards to longevity medicine in this way improving emotional lives, mental health wise? Do you see anything like that? Hey everyone, just a real quick interruption. I'm really excited to tell you about PhysiVantage, a company I have used for years and years and who I have recently partnered with in an ambassadorship for the podcast. This is one of the highest quality supplement companies out there. And the best part is I know the owner and his commitment to quality in his products. I actually interviewed the owner, Eric Hurst, on the podcast a while back, and you can hear him talk firsthand about his commitment to quality in episode, I think it was 171, if you're interested. Also in that one, there was a ton you can learn about aging optimally and performing at your best. I think when people make the decision to add some supplements into their daily habits, they don't think often how important it is to know and vet the companies you are buying from. There is no regulation on supplements. And so when you buy something, you really have no idea what you are getting. You really want to vet the companies heavily so that you know what you are spending your money on and exactly that you're getting exactly what you believe you are buying. So with PhysiVantage, you really don't have to think about it. What you buy is the highest quality of what you can get. I use the PhysiVantage PowerPlex plant-based protein complex. And no, I am not plant-based, but I'm not doing well with dairy right now, and whey protein causes some issues for me. This is something I'm working on. But in the meantime, in order for me to get in my optimal daily protein amount for maintaining lean body mass, keeping my appetite in check, and for athletic performance, I have to supplement with a protein powder, and this is my favorite. I alternate between vanilla and chocolate, and this plant-based protein complex is different than others out there in that it includes all the essential amino acids. So it's like a whey protein, has all the essential amino acids. Most plant-based protein powders don't. It also has creatine and beta-alanine in it. These are huge bonuses. Plus, PhysiVantage plant protein only has a few carbs in it, where most plant protein powders have lots and lots. If you do well with whey protein, then use their whey protein blend. It's also really great. PhysiVantage has lots of great products that you can check out, but another one that I find so helpful for my goals and lifestyle is Redux HP. And this is an all-natural pain relief, which helps to improve recovery from rigorous exercise, supports a healthy inflammation response, combats muscle breakdown, and improves performance. But the best is it's an all-natural way to relieve aches, pains, and muscle soreness. This has saved me from popping ibuprofen for the couple of migraines I was getting twice a month, as well as when I had a big climbing or biking day and would wake up sore. So if you don't know how bad things can get from popping Ibu, do a little research. Avoid Ibu, in my opinion, really important for our health long term. So anyway, using this product instead can be a really great way to lessen pain naturally and inflammation. You can get a discount on any PhysiVantage product by going to physivantage.com. PhysiVantage is spelled PhysiVantage. So like physical advantage, PhysiVantage, and use my code Heather Heinen. Capital HEATHER, capital HEYNEN, all one word, no spaces, Heather Heinen, and you will save some money on any product you choose. I also have a link in the episode description below that you can use. Check it out and see all that they have to offer.
Yes. Now I can't give you cause and effect.
I get it. Yeah.
But we have, observationally, we do a bit of anti-aging and biohacking. People will come in for IVs for different reasons,
Sure. Yeah.
exosomes, things like that. And most of those people feel great, feel energy, feel effervescent. They sleep better, they function better, they have more drive. And those people tend to be emotionally better off when everything else is cooking along.
Yeah, well. Your energy is high. Yeah. You're going good. Yeah, so you're resilient.
I don't know. We don't have a study to look at neurotransmitter profiles and depression inventories and anxiety inventories and things like that to say there's a correlation at least. Right. But as an observation, which is how any good science starts, I would say we do see improvement in that. And think about a joint pain person. If you treat a joint pain and they feel better, you're going to be less cranky.
Exactly. Well, I even think it's easier to move. You're moving pain-free. So the movement, is going to make you feel a little bit better, with all those things. Yeah. Okay. So another really selfish reason I asked you asked you to be is, so I'm a rock climber. And, I'm 50, and I've been climbing for about 25 years. And, as you get a little older, you get some of these aches and pains. And so I'm having, I have a couple things going on, but joints in my fingers that I think are more like inflammation. Like, I think it's called synoviolitis, like where the synovial fluid is inflamed, or does that make sense?
Synovitis, yeah.
Thank you. Yes. Not a doctor, obviously.
Well, that's what medical school is for, just to pronounce all these words. So, yeah.
Right. And so with something like that, is that literally, will you work on hands? It's all joints and
So as someone like you, we would evaluate the different joints. And so we have people that come in, they have multiple, joint pains. And sometimes we'll evaluate, but we might start with an IV because to the extent there is inflammation in those joints, the IV would be a general way to help suppress inflammation and slow down any degeneration going on from the repetitive trauma that occurs on those joints to do something you love, right? It's giving you your physical health, your mental health, your all that. So now if you had a one or two specifically bad joints, they may require direct intervention to the joint.
Gotcha.
And we would study that. We do high quality MRIs and look at them in detail, look for targets.
Yeah. Okay. That makes sense. So if someone, listening, if there's listeners out there, they're pretty much, they range in age, usually around, there's some younger listeners, but 35 to 75 is kind of the age range. So if there's likely someone out there listening, who is thinking, well, I've been told, I need a knee replacement or, that sort of thing. So how would you guide them to because this is what I envision. They're heading to their doctor, and around here, maybe heading to their doctor who may have zero idea about any of this. but they want to learn more. They want to ask more. Like, do you have any guidance on how they could talk to their
Yeah,
medical person?
that's a great question. You ask your doctor, hey, what are the regenerative or stem cell options? Even though it may
Mm-hmm.
not be stem cells, people understand
Sure.
when you say stem cells, we're talking regenerative medicine. And you ask, hey, and if the doctor says, hey, I heard about something, let me look it up, or oh, I
Mm-hmm.
know a guy who does that. Then at least you're
You
getting an
bet.
option. If your doctor says, oh, it's just not ready, or we don't know, that doesn't,
Mm-hmm.
it's proven wrong, or it's illegal,
Mm-hmm.
they're not fully informed, and you need to get another
Right.
opinion. That's all.
You
And
bet.
you know what? I hate to say it, but maybe 8 or 10 years ago, if you had come to me and said, "What about stem cells?" I would say, "Yeah, I just don't know. I didn't train to do it."
Sure. Yeah.
But
Yeah.
there are doctors who say, if it's not in the Kool-Aid they've consumed, it's a no
It
go.
doesn't exist. Right.
And do you want a closed-minded doctor? I mean, that's what
Yeah.
it is. Yeah.
Yeah. Great way to approach that for sure. Just getting curious,
Yeah.
asking a question, and then kind of making a decision after that. Yeah. How do you, let's talk a little bit about your business. It's called Recelebrate. I love the name.
Thank
That's
you.
a great name. Yeah. And you are located, I believe, in California and Las Vegas, or just Vegas,
We
or
closed down California. California's
okay. So you're
sadly falling off the map. It's a beautiful place. We
Mhm.
got all kinds of problems, and I'm not afraid
Yeah.
to say it. So I'm
No,
only in
yeah.
the Henderson, Nevada, which is Las
Yep.
Vegas suburb.
Right there. Yeah, cool. So how do you, and I believe you do work with people who are not necessarily located right there. So how do you go about doing that? Like, are people having to fly down bunches of times, or how
No,
does that work?
no. Most of what we do is starts remotely, like you and I are talking now,
Mm-hmm.
and we get to know people. We do consultations, coaching. We get any labs, we get any medical records. We order MRIs, proper MRIs. Not all MRIs are the same. Of anything we
I've
might
heard you
need.
talk about that somewhere. I heard you talk about that. Yeah, I didn't know.
Yeah. Yeah, it's like you can get a hamburger at Burger King, or you could go to the fanciest restaurant and get a Wagyu. It's
Sure.
very different, and we want the best high quality images because we will miss something if we do not have that. So
Yeah.
we're very particular about that, and we can usually help people get those remotely. They send the MRI digitally to us or by mail,
Mm-hmm.
and then I can pull it up on my screen, share my screen, and show them and what's going
Cool.
on, and we can correlate what we see on the MRI to their symptoms and their symptoms back to the MRI, because not
Great.
everything
Yeah.
you see on an MRI is necessarily a problem, right? So
Yeah,
we have
sure.
to do that important part, and then only if they're a candidate, would we invite them down to Las Vegas area for something, and people don't mind. They come spend the weekend, take in a show, have a nice dinner,
You
whatever.
bet.
Yeah, so it's easy to get to generally. So most of our clients actually come from somewhere other than Las Vegas.
Oh, interesting. And that was you just brought up another question in my head. What's recovery? So we'll give an example. Let's just say it's a knee.
Okay.
Lots of people with knee stuff.
Yes.
So you do the injections at the site, and then what's recovery time like from that?
So, we do the injections, wait for it. We do the injections in the bone edge, just adjacent to the
Okay.
cartilage. And let me
Yeah.
explain that, and then I'll finish the
Mhm.
answer if that's
Sounds
okay.
great.
We do this when I got into this field. I said, whatever we do, I want to do the latest and best protocol. So
Hmm.
this protocol comes from France, and they have
Hmm.
published their 15-year follow-up, and soon, hopefully, their
Mm.
20-year. And they
Cool.
will have proven with their studies that in joints, and it was a knee study, but we extrapolated to other
Hmm.
joints. In knees, if you inject the bone edge, the old growth plate,
Hmm.
where the cells are that make cartilage,
Hmm.
uh, those patients have better results and longer lasting
Mm.
results than injecting the joint. And if you think about it, the joint
Huh.
is made of cartilage, which doesn't have a lot of cells, doesn't have a lot of blood flow.
Right.
It's barely alive. It's
Yeah.
biological rubber. And just like your
Yes.
scalp cells, the follicles in your scalp make a protein called hair, your
Hmm.
cells called chondrocytes in the bone edge
Hmm.
make cartilage. So we want to
Hmm.
stimulate the cartilage making cells that created that joint in the first place. So we
Got
inject
it.
the bone, and because that sounds painful, and it can be, we do this under twilight sedation, not general
Hmm.
anesthesia. So
Okay. Yeah.
in a little injection facility, clean, sterile, and everything. So
Yep.
people are sore for a few days to a week, but there's no downtime. There's
Oh, that's
nothing
fascinating.
like go back. We want them to stimulate the joint and all that we call mechanoreceptors, the little cells that
Sure.
feel pressure and release a little call for help, and then the regenerative cells can then help that area best.
That's great. Okay. And interesting too. So really, I'm just thinking, injection versus knee replacement, really minimal downtime.
Oh yeah, for sure.
Yeah. Yeah. Do you have any stories or examples of like maybe people who came to see you and just had some really outstanding outcomes just for the listener to kind of get an
Yeah.
idea of what is possible?
Yeah, I have some favorite stories. One of them is I have this. She was 79 at the time, a wonderful lady from Pennsylvania that actually moved here to Vegas. She was local to me, and she
Hmm.
had aches and pains. And she came in and said, "My doctor said I have arthritis," and she had aches and pains
Hmm.
throughout her joints. And she was doing some crafts. She would paint these rocks beautifully. These little rocks. She brought me one. It's in the other room,
Oh,
or I'd show it to you. But
yeah.
she couldn't do it anymore. She was having too much pain. So we did an IV on her, and
Hmm.
she had a wonderful response. Her inflammatory pain was significantly diminished. She could go back to her activities. She actually had partial blindness in one eye most of her life,
Mm.
and I had no expectations at all. But she said
Sure.
she could start to see light again on that side. So I don't know
Fascinating. You
what,
sure, I get it.
but
Yeah.
wonderfully. But anyway, she said, "Well, when do I do the next one?" I said, "You tell me when your pain comes back." So she went
Hmm.
2 years before she came back for
Oh,
another one. So she was
that's pretty
she's
awesome.
81 now, I think. So you can be there's no age restriction.
Yeah, right, right.
And
Yeah, fascinating.
another one, a local patient of mine, also becoming a friend. He works for the local Brotherhood of Electrical Workers, and we have
Hmm.
there's always something being built here in Las Vegas, so they're very
Oh,
busy.
yes.
So he
Yes.
had really bad knees. He had gone and seen an orthopedic surgeon who did arthroscopy scope to the knees and cleaned them out. He
Hmm.
had no benefit. So we did
Oh.
MRIs, and turns out it was really the kneecap cartilage that was giving him his symptoms. So I injected both kneecaps,
Mm.
and he has been able to work and walk, and because he wouldn't even go walking any longer. So
Sure.
we not only did we help that guy, but we helped. He did not get benefit from someone who looked at an MRI of his knees and said, "Oh, you have
Yeah.
meniscus problem." They cleaned it up
Hmm.
well. They treated the MRI, but
Sure.
they didn't treat him, and
Yeah,
he had no
yeah,
benefit from the surgery. So those
yeah.
are some favorites.
Yeah, that's great. What about sometimes with talking about stem cells, there's some ethical questions that sometimes get asked about where those. So I'd love for you to just talk on that a little bit. And
Yeah,
then also the other part would be just cost, just,
yeah,
because insurance doesn't cover. So would you mind just touching on
yeah.
those two things?
Totally. So the source of the biologics, I like the youngest source. So these come
Hmm.
from donors who are,
Hmm.
congratulations, you just had a baby by C-section, and
Okay.
we're gonna throw away
Yeah.
all the baby making parts, in the womb, right? We're gonna throw
Hmm.
away the placenta, the umbilical cord, the amniotic fluid. You
Right.
don't need it anymore. You have a healthy baby. So
Yeah.
but there's a process that people can donate that,
Okay.
and through a proper, clean process. It's the same people who do harvesting of organs and things. It's a
Sure. Yeah.
donor services, and and then there are labs that are ironically FDA approved and certified labs that will handle the material, test it, screen it, and make it available to us. So you know
Okay.
that's where we get it. It's completely ethical
Hmm.
and moral. Anything you hear otherwise is probably some media spin from big pharma
Sure.
trickling down into your ear.
Okay.
Oh, and
Sounds
cost.
great. And yeah,
So
cost. Yeah.
yeah, so typically, a joint like a knee would be at least two doses, one above and below the
Hmm.
meniscus, depending on what we're doing. Sometimes it's more, sometimes it's less.
Hmm.
And the facility with the anesthesiologist to
Hmm.
sedate, do the twilight. that cost me $1,500. I just pass that on to you. I don't make money there. And each dose of the biologics can range, around 1,500 to 2,000 to 2,500, depending on the dose. The IV doses, we can even go higher than that. So a typical knee might be in the $10,000 to $12,000 range.
Okay.
If you did both knees and more, it could go up. If it's a single dose, we could get it even down. So if you have a health savings account or flexible spending account, you can use that. Yeah.
Okay. Yeah. Great. And then one maybe last-ish question, because maybe I'll think of one more. But we touched on it. You mentioned something a little while back about it was when I brought up my stepdad and his knees, and you're like, but you mentioned we work with people. It sounded like more on lifestyle stuff first. So were you talking, like, do you guide people through, and I guess maybe we could just talk about or let listeners know, do you need to change lifestyle things before, during, after something like this?
Listen, if you want to get the most out of this, you want yourself to be the most receptive. You should, if you're not focused on a healthy diet, activity, sleep, mindfulness, reduction in neurostress, supplements, protein, exercise. What am I missing?
You're doing pretty good.
Hormone optimization, both men and women, then you're not going to get as much out of it. We still can do it.
Okay.
Listen, I want you to do well. If you're going to spend this money and do this, I want you to have the outcome and be happy about it. So we do help guide people who need it. Now, a lot of the people who are already inclined to seek stem cell type treatments
they're probably doing a lot of that.
Enthusiasts. So luckily, when I meet people, most of them are already there. Now, I do see people like you. Oh, my father, my mother. So we see these other people who haven't lived a healthy lifestyle, and that requires some attention.
Yeah, for sure. Yeah, I was just thinking. Yeah, spot on. Just if someone's considering this, probably well worth also figuring out some lifestyle changes that can just optimize all of that so that it is long lasting, because it's a bit of an investment and that sort of. Although I'm surprised it's not as much, just personally, not as much of an investment as I thought it was going to be. So that's kind of exciting,
And the exosomes are a fraction of the price because amniotic fluid's so abundant that you can do that. We don't have to harvest umbilical cord cells and do all that. So
right.
exosomes are a much more efficient way to get the job done.
Yeah. And then, one last question. This is, things always are popping in my head. But with the IVs, is that specifically stem cell? Is that a mixture of things? Like, what's in the IV stuff?
We've done both. I prefer the exosomes, generally speaking, unless you are recovering from a heart attack or some kind of pulmonary insult, in which case we might go with the cells. They cost more, but the heart and lungs preferentially take up stem cells because they're big and sticky. So it just depends.
Got it. Okay. Well, anything else you would like to offer? Anything I missed in asking you that you'd like to share with the listeners?
Yeah, you didn't ask specifically what's coming or what projects we're working on, so I'll ask that of myself and throw
tell me. There. Good.
Sorry, I didn't mean to step on your purview, but
please, makes it easier.
We've got some projects too. The two projects I'm particularly interested in is one is exosomes are generic, right? Stem cells make exosomes, and in fact, all cells make exosomes. So what we're tapping into is, and we're not allowed to manipulate or change anything in regenerative medicine, but we can separate. So we can take a fraction of exosomes, and there are ways to filter and through affinity columns and others pull out certain types. Well, there is a certain type of exosome that comes from one of the immune cells in our bone marrow that is designed to identify and selectively kill/remove abnormal cells, e.g. cancer cells.
So
we're looking at this as a potential augmentative thing you could do for cancer, whether it's injected into a solid tumor or IV, and may that possibly have preventative applications. So we're looking at that. The other is a mitochondrial heavy exosome that donates mitochondria to your cells. So you think about frail people losing muscle mass, or recovering from injuries, have been debilitated, maybe laid up for months.
Right.
Is there another, some illness, or people in nursing homes? This, because, muscle mass and bone density are directly correlated with longevity. So if you're maintaining if you're moving, you're maintaining your muscles, and the muscles maintain your bone density if it's weight bearing activity.
Right.
So keep moving, you'll live longer. So we may have a way to sort of biohack that with these mitochondrial donor exosomes.
Fascinating. Timeline on some of those things, like where maybe you have some answers?
Yeah, I know we're trying to get our hands on these, so they're available outside this country now. So I would say 1 to 2 years before I routinely have them available.
That's pretty exciting. It really is. Yeah. Can you let the listeners know, where can they find you? Can they follow you? Social media stuff, just anything you want them to know.
So thank you for that. You mentioned earlier my practice name has changed. It's now called Recelebrate, because we're celebrating the renewal of your cells. So if you search that term, that's the name of all our social media, our website, and everything. You'll find us. It's RECELLEBRATE. Recelebrate.com. Recelebrate on Instagram, LinkedIn, Pinterest, YouTube, whatever. If you really want to nerd out, we have some YouTube videos with lectures I've given
seen some of them. They're
how
great.
it all works.
Yeah, cool.
It's a little bit heavy, but if you're if you're like me and you don't mind it, then it's out there.
Absolutely. Yeah, great. Okay. Well, thank you so much for being here and all that information. I find it fascinating. So I really appreciate your time and just expertise with it. Really appreciate you being here.
No, it's been a pleasure and nice meeting you. And I hope if we can just help one person by us talking today and it gets out there, that'd be great.
Yep, I agree. Thanks again.
Thank you.
Did you know you can find a lot more help from me on my website? Go to heatherheynen.com. Heynen is spelled Heynen, and there you will find links to my online courses, how I work with clients one-on-one, as well as online with my coaching and counseling services that I offer. The information in this podcast is intended to provide a broad understanding and knowledge of healthcare topics. This information is for educational purposes only and should not be considered complete and should not be used in place of advice from your physician or healthcare provider. We recommend you consult your physician or healthcare professional before beginning or altering your personal exercise, diet, or supplementation program.